Miss Emily. My name is Rose and I'm a student nurse, and I'm going to transfer you from your bed to your chair. Is that all right with you? Hand job my hands. I'm going to get my gloves. Okay. Can I please check your ID? Can you tell me your name and your date of birth?
August 4th, 2006.
Correct. I'm going to lock the bed, make sure it's locked, and it is. And I'm going to lower your side rail and get your wheelchair. When I get your wheelchair, I'm going to lock the wheelchair on both sides, make sure it is locked. Okay? Now, I'm going to remove your blanket from you so we don't get tangled up in it. And I'm going to now position you on your side. If I go too fast, let me know so I can slow down. I don't want you to get dizzy. Okay? All right. So now I'm going to roll you on your side. Right there. Okay? And I'm going to dangle your legs down. Right there. Now I'm going to sit you up. 1, 2, 3. Let me sit you up. Okay? And I want your legs to be touching the ground as they are. Before I would have done that, I would have positioned her, lowered the bed if I needed to, or raised the bed if I needed to, in order for her feet to be flat on the ground and get her ready for transferring her over. I'm going to place, this is a gait belt. I don't know if anyone's ever used it on you, but I'm going to explain to you. This will go around your waist. I will stick it through the teeth. I'll loop it through the teeth. I'll loop it back through here. And it'll give you secure, tight lift. I will, if this is long, I will roll this in you so it doesn't dangle, okay? And get in the way to transfer over, okay? I'm gonna place this on you now. Can you lift your arms for me? And I'm going to use the 2-finger when I am tightening. I usually put 2 fingers. This is the patient side, this is my side, as I'm tightening, so I know that I can secure, not to injure or make it over tight for the patient. I'm going to go ahead and put my 2 fingers in, and I'm going to dangle my other one, and I'm going to pull and move. Pull and move. Once I've reached my limit, I put it back through the hole, sorry about that, to tighten it. As you can tell, I can still put 2 fingers in there, and she's still secured. I'm going to go ahead and put that through the back. Dangle it through the back. Then I'm going to move the wheelchair. I'm going to put on her slippers as well. You can also do non-slid socks, but in this case she has her slippers, so we'll go ahead and use her slippers. Okay, so I reposition the wheelchair. I need to do body dynamics. I need to lower myself so I'm not hurting my back when I pull up, and I also need to bend my knees. My knees is the support that she's going to need, so when I lift her and position, it'll be easier to do. I'm also going to put my knee up against hers to help guide her to the chair. Okay, so on the count of 3, I'm going to go ahead and stand and pivot, and my knees are bent. 1, 2, 3, stand and pivot. Once she's in this position, I would put her footrest and her footrest here. I will take off the gait belt. Okay, I got it. So we'll take off the gait belt. I would clean it. I'd sanitize it And I would handheld you. I would bring her call light. Make sure she has that before I exit the room. I would ask Miss Emily, do you have any questions for me? Is there anything else I can help you with before I exit out of the room? Thank you. And that concludes